Hello, my name is Dr. Kevin Campbell. I'm a contributor for MD Magazine. Today at the American Heart Association annual meetings in New Orleans, the first of several very important clinical trials were presented. One of the trials that I think has particular interest for almost any physician, no matter what your area of practice, was called the Precision trial. It was presented on Sunday afternoon around 4 o'clock Central Time. In the Precision trial, researchers compared the use of COX-2 inhibitors such as Celebrex with standard NSAIDs such as ibuprofen and naproxen. As you know, Vioxx, another COX-2 inhibitor, was pulled from the market several years ago due to concerns over a perceived risk for increased cardiovascular events in patients who took these drugs on a daily basis. The benefit of these COX-2 inhibitors is they've been associated with less gastrointestinal bleeding in patients who need them for daily use for particular conditions such as arthritis. In addition, another study suggested that naproxen may actually be the very best cardiovascular risk profile in patients who took it regularly. So the Precision trial looked at comparing these drugs in order to determine what drug was best for our patients in what setting. So in the Precision trial, nearly 25,000 patients were randomized to either receive Celebrex or ibuprofen or naproxen. The study was actually designed to determine if Celebrex was non-inferior to standard NSAIDs as it pertained to cardiovascular risk. Researchers found that in fact, Celebrex was non-inferior. After 25,000 patients were enrolled in studying, the data was analyzed. It appears that patients who are at risk for cardiovascular disease or have cardiovascular disease, that Celebrex did not increase the number of cardiovascular events or increase risk. In fact, it also found that naproxen did not appear to lower risk as compared to the other two drugs that previously studies had reported. This trial has really the potential to significantly impact our practice. So in patients that come to our office with arthritis who need daily anti-inflammatory treatment, it may be reasonable to use either a COX-2 inhibitor like Celebrex or traditional NSAIDs such as ibuprofen or naproxen. Celebrex has been proven to have less GI bleeding than standard NSAIDs do, and this may be important in many of our patients who are on multiple anticoagulants for multiple different reasons. Again, ultimately, this trial now assures us that it is likely okay to use Celebrex in patients who have coronary artery disease or who are at risk for CAD without increasing their risk for events. While more study is needed, I think it's reasonable to start thinking about the way we practice medicine and the way we prescribe NSAIDs in these particular patients. For now, I'm Dr. Kevin Campbell, contributor for MD Magazine. I'll be back soon with an analysis of some other important trials that are going to be presented at AHA 2016 in New Orleans. Until then, I'll see you then.